What comes to mind when I say marijuana? Is it Cheech and Chong rolling in their Impala Supersport with clouds billowing out of their windows as they roll them down? Is it the image of endless snacks because you have the munchies? Or is it reefer madness and Nixon's war on drugs? Whichever it may be, everyone has some sort of view on the matter. Today I will be touching on how marijuana is seen as a gateway drug, as well as shining a light on a different perspective, the healing perspective. That marijuana can be substituted for certain pharmaceutical drugs, and how it can aid in the symptoms of depression and PTSD. So let's start from the beginning. Before the war on drugs even existed, marijuana was a thriving plant on all of the continents. It was grown openly and sold commercially successfully for centuries. Taoist priests labeled this psychoactive plant to only be used by shamans. Muslim countries, they use hashish in their hookahs, which is an everyday leisurely activity. So where did the tide shift against such a profitable and relaxing plant? Sometime in the mid-20th century, the working class was observed using marijuana recreationally and medicinally. This struck fear into the eyes of the upper ruling class. Thinking that the use of such a crop would disrupt the political and economic order they worked so hard to maintain, this led to prohibitions, the war on drugs, and I'm sure all of you have heard that marijuana is a gateway drug. All of these tactics were used as propaganda to dwarf, if not completely halt, marijuana cultivation. According to a study done in 2015 by Villa, Garcia, and Wang, called On the Probability and Predictors of Cannabis Gateway Effect, it was shown that adolescent mice that were exposed to cannabinoids early on showed decreased reactivity of the brain's dopamine reward centers that also affected them later on in life. These findings correlate with the narrative that marijuana is a gateway drug in humans. But also in that same study, it had shown that the participants that partook in marijuana didn't do harder drugs. In fact, marijuana can be seen and be used as a substitute for some pharmaceutical drugs. In Michigan, where marijuana is legal, recreationally and medically, a study was conducted in 2019 by the University of Michigan that found 44% of 450 adult participants who were surveyed, saying that they were able to completely cut out, significantly reduce a medicine, or both, with the use of marijuana. Those same participants stated to have used marijuana to treat headaches, pain, and depression. Another study done recently in 2001 by Peterson, Thompson, and Thielstrup, called Exploring Cannabis as a Substitution for Prescription Drugs in a Convenience Sample. Their findings were that more than half of the participants were able to substitute their medications for pain, antidepressants, and arthritis for marijuana. These results were especially astounding when marijuana was supplemented for the opioids, where 67.2% of all participants were able to make the swap for the medications for marijuana. Marijuana is great for physical ailments, but what about those that are invisible to the naked eye? In the same study done by the University of Michigan, marijuana aided in the symptoms of depression. Dr. Kolk, in his book, The Body Keeps Score, stated that his patients with severe PTSD were able to use marijuana to cope and to aid in their triggered episodes, to try to return back to a somewhat normal life. Through my own experience in the local Oklahoma marijuana industry, I have come across a lot of apprehension about marijuana use. If you are curious, I can assure you that there is a product out there for you. Whether it is a good old-fashioned joint or something a little bit more smokeless, like an edible, a tincture, or a topical. My advice to you is to always do an experiment within your comfort zone. And if all fails, just ask a friend. There are plenty of experienced and knowledgeable people just around the corner. Everyone has fear of the unknown. What monsters may be waiting for you in the dark. But everyone's journey has to start somewhere. It's very possible that marijuana isn't for you, and that's okay. But if you're one of many that are affected by common ailments that are treated with multiple artificial prescriptions, I can confidently suggest that marijuana is a good possible option for you.